actually where it is, but this is as close as we have on the model. So if I were to use a model like this and label right in this area, I would want you to call it the temporalis. If we look at this model, it's the same problem. We don't have the actual temporalis present. The only one we have that actually has the correct temporalis is this model. So with that said, if that creates any confusion for you, you could ask, you're talking about, it might say, which muscle of mastication is this, or, something along those lines. If you're confused, you could say, you're talking about, like, that connects down here to the mandible, or, some sort of question along those lines. I'd be happy to answer that. So our temporalis sits here. The nice thing about at least the superficial muscles of mastication is if you clench your jaw, they get short, right? If I clench my jaw, masseter gets short and fat. You can feel it. All right, masseter on this model right here. And masseter on this model, very difficult to see because it's got a real big parotid gland, but it sits right beside it. Masseter on this model, a little bit larger. We see that right here. But in every spot, it's at the posterior border of the mandible, and if you squeeze your jaw together, you can feel it. Temporalis, same thing. Clench your jaw, you can feel it. The pterygoids, there is no model that shows you the pterygoids. Maybe back here on this model, but it's so difficult to identify that I don't typically mark the pterygoids on one of these type of models. What I will do, because we will have a skull station to identify teeth, okay, I will label the pterygoid processes off the sphenoid bone, and I will ask which muscle of mastication attaches here. Okay, so there are 4. And if you recall from AMP1, some people had difficulty because we also see part of the nasal septum or part of the vomer down here. That's in the middle. The 4 are lateral to that. So outside, we have the lateral pterygoid process, which would connect to the lateral pterygoid muscle. And in this case, we need to know right versus left. So if I'm looking in this direction, I have to understand right lateral pterygoid, left lateral pterygoid. Okay, so knowing direction, you can move this, right, as long as you're not, again, signaling somebody else. You're just discreetly doing so for your own sake. That's fine. All right, so if you're putting your finger on that spot and turning it so you can orient to which direction, that's okay. But you'll need to know right and left. So on the outside we have lateral, on the inside we have medial. Along with that, I'll label typically part of the hard palate. So again, we want to know, which should be review, that the maxilla, this jaw on here, it's a little difficult for you to see, but the maxilla makes up the anterior portion of the hard palate, and the palatine bone makes up the posterior portion of the hard palate. So I could ask a question about that because that's related to the oral cavity. The other questions you will see on a skull model will be related to the teeth. All right? I will just point to a tooth, say, what is this? And you will need to say, you don't need to worry about right or left or up or down. You don't need to say your right upper first premolar, but you will need to say first premolar. All right? So this is mostly counting. So we have our medial incisor, our lateral incisor, our canine, our first premolar, second premolar, first molar, second molar, third molar. All right, so a lot of it's just counting. So you'll need to be able to identify, I'll probably have a couple teeth marked, and you'll need to be able to tell me what tooth. I don't care on this one, left, right, up, down. Okay? I just want to know which tooth. Move some of these out of the way for a second. Okay. Salivary glands wise, we can identify parotid, which we pointed out earlier. We also see parotid on a model like this. Right. Submandibular. Is below the mandible. Right. Sublingual, we don't see that on this one very well. So on this model, we see our parotid and our submandibular. On this model, we see parotid, submandibular, and sublingual. So we can identify all of those. With our tooth model, typically this is one of the best models. Sometimes I get very close to having 100% across the board on this model. Right? It's either 100 people will get 100% on it, except for the people who do very poorly on the entire test. But anyway, people do well on this for whatever reason. So if you look on the side, 1, 2, 3, these are the regions. So this would be crown 1, neck 2, root 3. So if I said what region, you would be telling me one of those 3. All right? And you could ask, you'd say, are you talking about this whole area? Or you're talking about the specific part here? And I'd say, I'm talking about this area, not this area or this area, one of those regions. When we open it up and we look inside, we have some more numbers that tell us different parts. So the white portion is going to be our enamel. On here that's labeled 4. This inner kind of region with the lines, that's our dentin. That's number 6. Number 7 is this pinkish middle region, which is the pulp. Number 5 down here on the neck and root that makes up the outside, that is cementum. I don't know if I have that on the list. Tooth model. There we go. No, don't have that on the list, so add that to your list. 5 is cementum. I'll try to update this and repost it. Then I could say with number 5, which type of ligament attaches, or what's the name for the ligament that attaches to this substance? You would say periodontal ligaments. So we need to add the cementum and the periodontal ligaments to the list, it looks like. So to review, crown, neck, root, enamel, dentin, pulp, cementum, periodontal ligaments.